Hey everyone, I'm Anna Esparham, back at the Dr. Anna M.D. podcast and YouTube channel. If you are listening on the podcast, but you do want to take a look at the slides that I have regarding the topic today, you can go over to the YouTube channel at Dr. Anna M.D. I'm going to be talking about preventive supplements for headaches, the top three nutraceuticals that I use in both pediatric headaches and adult headaches. These three supplements are usually my go-to before I start any preventative medication. And so those top three are magnesium, riboflavin or vitamin B2, and CoQ10. If you guys are interested in learning more outside of just the three preventative supplements that I'm going to talk about today, because there is probably hours and hours of education and how to implement a lot of these different supplements, therapies, and medications for headaches, you can go over and check out my comprehensive pediatric headache course over at drannamd.com. So there are two different management techniques for headaches. One is prevention and one is abortive. We headache physicians like to focus on the prevention component because the abortive component consists of either NSAIDs or triptans or other modalities that may actually worsen headaches in the long run if they take too much. So if a patient takes more than, 10 to 12 ibuprofen, Tylenol, Excedrin per month, or if they take more than 8 to 10 triptans per month over a 3-month time period, it can lead to a medication overuse headache. So that's why we're going to focus on preventive headaches currently. So the prevention of migraines usually take about 8 to 12 weeks to become effective. So this includes both supplements and medications. And the research shows it's usually around 3 months. Now, the research studies have only studied one preventive supplement or medication at a time, not all three together. So what I'm seeing in practice now that if someone can, especially if they're buying over the counter or if they're buying at Amazon, for example, or their natural food store, buying these nutraceuticals, the magnesium, the riboflavin, and the CoQ10, if they can afford it, then it seems to take about anywhere from 4 to 8 weeks to start decreasing the headaches in terms of both frequency and intensity. One of the issues with medication specifically, especially in the pediatric trials, is that most studies are negative. They have a very high placebo rate, so they don't really show efficacy in terms of the medication being better or more effective than the placebo given during the research trial. So very high placebo rate, up to 50 to 80% for several of the medications studied. And this is very common, especially in the pain field, both headache and pain field, when they're looking at medications, because there is some component of definitely the mind body that is involved in the headaches. So the preventative medications, I'm just gonna show you guys very, very quickly. A lot of them unfortunately have significant side effects, and that's why we typically go start with the nutraceuticals or the supplements first because they have a little bit of a better side effect profile. So some of the preventive medications can include anti-seizure medications such as topiramate, the beta blockers, which are propranolol or atenolol, the tricyclic antidepressants such as amitriptyline, and then an old antihistamine known as cyproheptadine. There are some other ones that we get into, like calcium channel blockers, ACE inhibitors, uh, SNRIs, the serotonin and norepinephrine reuptake inhibitors, SSRIs, and the muscle relaxants and bridges for medication overuse headaches, such as meloxicam. But for the purpose of this podcast and show today, we're really just going to talk about the top three nutraceuticals. Okay, so we discussed we're going to look at magnesium, but there are several forms of magnesium. The one that's in the formulary, so at the pharmacy, is typically magnesium gluconate. There are the liquid formulation can be magnesium carbonate or magnate. The pill form, which is magnesium gluconate, usually for the older children that can swallow pills, unfortunately, it's a very, very humongous pill that the kids do not like to take. So most often they get it over the counter where they can take smaller capsules for the same dose. Then riboflavin, which is vitamin B2, this is also found at the formulary, usually in 100 milligram tablets if insurance covers it. And then CoQ10, I haven't gotten great success with insurance coverage, but it is also found in the formulary. We won't go over the melatonin, iron, omega-3, vitamin D until a later episode, or if you guys are interested, can always sign up for the comprehensive pediatric headache course that I have on the website at dranamd.com. Okay, so let's dive a little bit deeper into magnesium. So I have up here the forms glycinate or gluconate. These are just the most common forms that most people can get. The other forms include magnesium malate or magnesium L-threonate, for example. Those can be a little bit more expensive when you're buying them online, but they do have some evidence for better bioavailability. For example, magnesium L-threonate crosses the blood-brain barrier just a little bit more than the glycinate form, and the magnesium malate is more beneficial potentially for mitochondrial dysfunction. So just kind of keeping that in mind when people are presenting with headaches, but also have other symptomatology that you may want to consider other forms of magnesium. The typical dose for anyone over 40 kilograms or someone that's usually 12 and older is about 500 milligrams daily. Under 40 kilograms is 10 milligrams per kg per day. There are chewables, there are gummies, and there are liquid formulations of magnesium. So you have to figure out the dose for the younger child. Usually you want to take with water because no matter what formulation it is, the magnesium does get absorbed in the gastrointestinal tract and does cause some looser stools. So you just have to be cautious with that. The oxide and citrate formulations we don't tend to prescribe because they do cause more stomach cramps, loose stools, and so we have to caution parents to avoid the oxide and citrate formulations. Those are more for constipation. So again, side effects, thinking about diarrhea, loose stools. Some kids are, which is very, very rare, do they get very, very sensitive to magnesium and cause loose stools. But if they do have a chronic kidney disease, they're working with a nephrologist, you do have to discuss with a nephrologist to make sure the magnesium is okay. So the mechanism of action, it works so well for migraines and other types of headaches, even though there isn't great research for other types of headaches besides migraine, is that it decreases inflammation. So decreases neurogenic inflammation specifically, antagonizing glutamate, which is sort of a neuroexcitatory a neurotransmitter. And it also regulates central nervous system cell signaling, especially in pain transmission. All right, so we talked about magnesium. Let's talk about the other preventive, vitamin B2. Vitamin B2, also known as riboflavin, is a bright yellow B vitamin. So it makes the urine very yellow or orange. So you do have to caution families on this because sometimes they get very concerned about that side effect. Elementary age school children usually take 200 milligrams daily. I typically recommend it in the morning with breakfast because it potentially does have a little bit of energizing effect. Older children and adolescent can take 400 milligrams daily. The formulary, like I said before, has 100 milligram tablets. The younger children, it's harder to find over-the-counter liquid, and I have not yet found a ton of different gummies, but I do think it's out there. I think I recently had a patient that was able to find a gummy form of the riboflavin. It the mechanism of action is that it is heavily involved in cell membrane mechanics, but also in mitochondrial transport, and therefore it may improve mitochondrial dysfunction, is also involved in the epigenetics of methylation. The coenzyme Q10, or CoQ10 for short, there's another name called ubiquinol, which is the reduced form, so it has more electrons. It is taken 200 milligrams daily. The studies have done twice daily dose, but several of my patients cannot remember to take their second dose, and sometimes they take it closer to night, which if you take it closer at bedtime, it can cause insomnia just because of also that energizing effect. So I usually just give 200 milligrams a day. That is the dose to prevent migraines, and it comes in several forms in gummies and liquids and soft gels. Um, the mechanism of action is that it's involved in mitochondrial electron transport chain, so it improves that mitochondrial dysfunction, but it also acts as a free radical scavenger, especially if it's that reduced form, and doesn't really carry that many issues. There's been some allergies reported, and then again, it just has a little bit of energizing effect, so shouldn't take too close to bedtime. Okay, and I think that's it. That's a little overview of the top three preventative supplements. The key to this prevention is that these supplements really have to be taken daily. I have seen some patients who have missed one dose, two doses, three doses, and the migraines do get worse again. So it really is that daily preventative treatment. And these seem to have really minimal risk in terms of a lot of the adverse reactions compared to medications. And I do see anecdotally, this has not been studied, at least not recently, that I've seen where taking all three together actually does decrease the length of time it takes to work. So, as most preventative supplements or medications, like I said, take up to 8 to 12 weeks. So, if someone is coming in with chronic daily headaches, really a lot of families don't want to wait 8 to 12 weeks for it to work. So, I do see this trifecta, the magnesium, the riboflavin, and the CoQ10 work a lot faster. All right. I think that's it. If you guys want to learn more, I have the pediatric comprehensive management course online at dranamd.com. And that's a little bit more comprehensive. I will have a series, but that first course is a big general overview on how to manage migraines and headaches and implement that into your practice. All right. We'll see you guys for the next episode.